Kia ora koutou. My name is Anne Paisley. I have recently submitted my PhD research, which examined the worlds of 4 trans secondary school students. Out of my analysis, it became evident that time was central to thinking about these matters. This presentation seeks to unpack some of the ways thinking about time in healthcare practices might produce better trans healthcare. Why do we make young trans people wait for gender-affirming treatment? The reason most often given is the notion of desistance, that is, cisgender people questioning their gender only to discover that transitioning is not what they want. Avoiding this prospect is typically motivated by not wanting young people to regret the potentially life-changing effects of social transition, such as experiencing prejudice, or medical intervention, such as the irreversible effects of hormone replacement therapy. The prospect of patients needing to retransition can seem like a medical failure, particularly when transnormative narratives frame transitioning as a matter of finding one's true, authentic gender, which makes the parameters of success quite narrow. Doctors and other healthcare practitioners are guided by the principle of doing no harm, and their conservatism around treatment is more often than not motivated by an accountability to the effects of their care. In Aotearoa, we are lucky that our trans healthcare guidelines also recognise that non-treatment can be harmful, so our approach is more balanced than many. Today, I want to begin by querying the consequences of delaying treatment, or if not delaying, of having to wait without a clear sense of when treatment will be received. To premise the ideas I will present, I draw on Florence Ashley's recent paper which argues that desistance is not a good indicator of what sorts of care patients should receive. They point out that given the cisnormative society we live in, transgender experiences of dysphoria as a result of not transitioning are not equivalent to the experiences of cisgender people who regret transitioning. Instead, Ashley argues that the opportunity for people to explore their gender, even if it results in regret, is beneficial to all because it opens up the possibility of better knowing oneself. Moreover, trusting in a young person's agency to explore their gender, even in the face of possible regret, is beneficial to anyone exploring who they are, and distrust typically only informs them that they will not be supported when they do make mistakes. Before I continue, it is pertinent to recognise that the results from the Youth 12 and Youth 19 studies indicate that rates of trans young people remain stable in Aotearoa at around 1%, which tells us that being trans or gender creative or exploring one's gender is not simply a trend, despite the anxieties of many assuming people would actively choose a marginalised identity to get in the cool crowd. Weird, right? Furthermore, these studies demonstrated that young trans people are now disclosing at twice the rate that they were in 2012, despite similar or worsening violence experienced in schools. So trusting trans people, who will most likely have been contemplating their gender for a long time, is also about honouring their bravery and creating a world where they do not have to be brave. In my thesis, at the centre of questions around how we create more just worlds for trans people, emerged the issue of how time works in these dynamics. Dominant Western understandings of time have framed time in particular ways, understanding time's arrow flowing uniformly from past to future through a sequence of presents. Time is understood as a container model, omnipresent, through which all other things move. These conceptions of time have their origin in colonization and notions of progression, which have become tied into capitalism and other normative systems that seek to organize our worlds. Elizabeth Freeman calls this form of time chrononormativity. For example, this is embodied in particular orders of events such as birth, marriage, children, retirement, and death, which Munoz called straight time. In 2005, Halberstam contested these normative orders of time by offering the notion of queer time, which reflected a world where queer folks couldn't get married or have access to having children, and who often died at non-normative times in the midst of the AIDS epidemic. Alternatively, Alison Kafer offered the notion of crypt time, which recognizes that disabled people often cannot perform the sorts of normative time that are expected of them. Crypt time pushes back against ableist ideas of punctuality, both in ongoing engagements with the world and life timelines. These ideas have been applied to trans worlds as well, such as Ruth Pierce's and other works around trans temporalities. But while these approaches to queering time recognize time subjectivity, like different substances flowing through different hourglasses, they do not challenge time's ontology. That is, they question the substance that drains through the hourglass, but not the hourglass itself. My thesis took an agential realist approach that conceives of time less like an hourglass and more like a tangle of possibilities and impossibilities. For example, today's symposium is tangled with transmedical pasts and injustices against trans people, the possibilities of justice that might have been, and a future where we recognize the possibility of more just worlds that sits alongside the possibility of less just worlds for trans people. While we know which future we would prefer, unjust futures inform our presence as well. Time is relational, so what becomes possible shifts as relations change. For example, Will Hanson's history of trans resistance in Aotearoa accounts for generations of trans people whose opportunities were very often constrained. Yet the advocacy they carried out was so profound that it made futures possible where the lives of trans people in the 70s and 80s are incomprehensible to trans young people now. These possibilities required a radical reconfiguration of how trans people are able to exist in the world. Finally, this paradigm understands that time is not simply a plane that we move through, but something that materializes in the world. Time is in a flower growing and blooming and withering. Time is in the texture of your skin. Time is in the trauma that haunts our lives, informing how we can be in the world. Let's look at some other ways time materializes for trans people. Time leaves marks. Sometimes they're quite explicit, such as the scars from top surgery. These marks are perhaps evidence of being too late to catch puberty. This might be an innocent case of not realizing one's gender until after puberty, or perhaps these are marks of delayed treatment, or messages that told this young person to wait, that they were too young to know. This is also true in the case of a body developing in irreversible ways, such as shoulders broadening with puberty. Amidst debates that argue that hormones have lifelong effects, it is important to recognize that puberty also produces lifelong effects. Other examples include the time lost or gained by feeling comfortable with one's body. One of my participants described how they had not been to the beach in years because they did not know how to navigate these spaces in their present body. While it is important to recognize that trans lives are not all suffering, delays or the inaccessibility of treatment can affect trans people in ways that their time is plagued by mental illness. We also cannot escape the reality that sometimes these challenges, among others, cut lives short, recognizing the high levels of suicidality in our communities. While I'm not looking to paint medical practitioners as heartless, it is important to recognize that time materializes differently for them. Making the decision to delay treatment another month does not impact them in the way it impacts their patient. These temporal delays manifest in many of the ways discussed, but also in the materialization of black markets for hormones when patients do not trust they will get treated in due course. These dynamics are also haunted by former requirements to embody one's gender for 2 years before receiving hormone treatments, and ongoing requirements for accessing surgery publicly. They are haunted by pasts where gatekeeping was more widespread, and the possibility of transitioning was so often unattainable. This is what it means for temporalities to be entangled. presence materializing with past and future possibilities. Among my participants, one student sat at the table and rubbed the stubble on their arms. They explained that this was their dysphoria manifesting as they waited for HRT. This was like a constant buzz in the back of their head, only they couldn't block it out. Another student described how the wait for HRT materialized as brain fade. They couldn't concentrate in school and would often sit in a classroom unable to engage in their education. Unfortunately, by the time they accessed treatment, they felt that the impact of waiting on their mental health had had lasting effects, and they did not imagine testosterone would suddenly bring back their focus. All of the students' mental health was impacted, but there was a particular desperation in one student who waited 18 months to get prescribed testosterone. This was because the first hospital lost their referral, then that hospital sent them to another hospital, then that hospital referred them to another clinic because there were uncertainties around whether they should be receiving pediatric or adult care even though they were 16 years old. They were then put on blockers for 3 months and were almost told to wait another month when they broke down in front of their doctor, who then took pity on them and put them on a low dose of tea. These sorts of temporal uncertainties leave students in precarious positions. The argument here is not to hand out prescriptions left, right and centre, but to acknowledge that there is an inequity in these approaches that is evident in the way time manifests. Time does not impact doctors in the way it impacts their patients. Recognizing the prevalence of harm via delay and the value of trusting patients to explore their own gender, the question becomes a matter of how we reconfigure relations in ways that produces time more equitably. So, in terms of what renegotiating time might look like in practice, you are the experts. You know your workplaces and how they run. Part of making your practices friendlier to trans patients is to consider how they might experience time in these spaces. How long are your wait times? How much time do they receive in their appointments? What sorts of delays exist? How are patients spending their time getting to access your care? Are there transport issues? Do they need to think about how they will justify their requests? How much gatekeeping do they need to overcome? Gloria Fraser's research demonstrated that gatekeeping practices are still widespread and patients feel they have to justify their gender instead of simply being trusted to know themselves. How can you and your fellow staff upskill? That might look like coming to the PATHA training day, or this conference. It might entail creating a support group to develop care strategies. However, this burden is not just on healthcare practitioners. For example, Stats New Zealand could have fast-tracked the inclusion of non-binary gender in the census, instead of exploiting community expertise and then ignoring their advice anyway. These delays mean that healthcare providers cannot provide official forms that recognise their non-binary patients, because they are bound by the Stats New Zealand metrics. Moreover, it might also just mean that more funding is required in areas that affect trans healthcare. For example, ensuring nurses' wages are adequate, so we don't experience nurse shortages, and nurses will be better resourced to engage in care. More mental health funding is needed, so people are not waiting for mental health appointments, and funding is not limited to 6 sessions. 6 hours to deal with a lifetime of cisnormativity is hardly adequate. By paying attention to the way time manifests in trans lives, it is possible to reconfigure healthcare approaches in meaningful ways. Thank you very much for listening to this talk. Here are a list of references that I used for this presentation, and if you have any questions that you don't want to ask in the Q&A session, feel free to send me an email. Cheers, thanks.